Hello and welcome to this week's episode of For the Love of Chiropractic. This week we have our second part of our two-part episode, The Great Day One. Last week we went through the entire patient intake part, getting them their paperwork, welcoming them into the office via the Great CA, getting them into the consultation room and what that consultation room needs to look like, feel like, and creating an air of confidence and certainty that they're in a professional place where they know they're going to be helped. And we went through the doctor's preparation of how they should review the chart before they even meet the patient. We went through the entire process of how to do a great history effectively with the patient so that, again, they know they're in the right place and you have all the information you need. We had to end that episode, that part one, with the patient leaving the consultation room as you're escorting them into the exam room, because I promised from the very beginning that these episodes would only run about 20 minutes because I think that's the optimum length for a podcast. So now on today's episode, part two, we'll discuss the exiting of the consultation room, what happens in the exam room, and how to dismiss the person for the day, and then what you need to do to prepare for the great report of findings, which will take place the very next time you see that patient. Welcome to another episode of For the Love of Chiropractic. I'm your host, Dr. Robert Freeman. I've been in practice for over 30 years, and I continue to work in a $1 million practice that I built, ran, and sold. I've taught, lectured, and coached our profession, and helped so many chiropractors build the practice and the life of their dreams. And now, I want to help you do the same. So here's today's show. So as I said on the introduction, on part one of The Great Day One, we took time to talk about getting the person into the office, getting them back into the consultation room. We talked about how the consultation room should be set up, and how you then enter that room and make the person feel at ease so they know they're in the right place and they're going to be helped in your office. And the reason that that's so important is because ultimately they buy the messenger before they buy the message. They have to like your office, and frankly, they have to like you, because if not, they'll happily go find somebody else, some other chiropractor who can help them, or God forbid, get turned off by this whole natural healthcare chiropractic thing and find themselves down the medical route doing the drugs and surgery instead of natural healthcare, which I think all of us can agree is a better first route of defense to help the body get better and stay better. So we finished out part one by closing out the history and then laying out for the person how the rest of the day is going to go. And if you just finished listening to part one, or you go back and listen to it again, you'll see that what we discussed was we explained how the examination was going to occur, broke it down into certain parts, and then we also just quickly explained what would happen after the examination occurred, how we would set up a time to go over all of the results. And then we said something like, okay, so follow me to the exam room. And as you're getting up out of your chair, you're watching how they get up and move. How easy is it for them to ambulate? You can ask them, if it's an acute patient, if they would like your help, and they'll tell you yes or no. It's improper to just reach out and try and help them, because if you do unasked, you're invading their personal dignity, and that's never okay. Would you like my help getting up out of the chair? Can I hold this for you? Can I help carry that for you? It shows you're kind, caring, listening, and working with them. From your office setup, the distance from your consultation room to your examination room should be as short as possible. I do like it to be a different room because, again, the exam room has a different feel than the consultation room. It's even more clinical than your consultation room is. If for some reason it has to be in the same room, find some way to have the examination equipment, quote unquote, hidden. Maybe it's behind a slider on a bookshelf, or perhaps a partial room divider covering part of shelves where the equipment is kept, Or again, think about what you see in some medical offices where there'll be a cabinet, the cabinet door gets opened, and then on those shelves are all the equipment that's needed. We even see that in hospitals that are trying to be much more humanistic. Again, because the clinical equipment can be kind of scary. We want the office to feel warm and friendly, not scary. So once you're in the examination room, I believe that the patient needs to be properly gowned, and in the state where I happen to practice, gowning patients for an initial examination is what's required. And the reason that it is required is because as a chiropractor, we are still responsible to inspect the skin. That's part of the examination process. If you're palpating through clothes, you're never inspecting the skin. Perhaps there's something going on right on the skin that's causing part of the problem. You'd want to know that. And even though we are not dermatologists, we are licensed as doctors. Therefore, if there is something on the skin, something that doesn't look right, we don't necessarily have to know what it is, but we have to be able to recognize that and make the proper referral to the proper medical specialist, perhaps a dermatologist, to have the skin condition handled properly. God forbid it's a skin cancer. You cannot stand behind the, well, I didn't see it, because you're still supposed to inspect the skin. So once you're in the examination room and you then have the gown in your hand, you can look at the person and you're thinking through what they're going to need to remove in order for you to do the proper examination. So I'll look at the patient and say, okay, Sue, so I'm going to need you to remove the sweater, the blouse, the earrings are fine, but I'll need the necklace off, and I'll need the jeans off as well. Now, at that point, stare the person in the eye, especially if you're a male doctor and it's a female patient, and you can say to them, if you're wearing a bra that clasps in the back, you can leave it on. I don't want you staring at their cleavage when you're talking about their undergarments. If, on the other hand, you feel you can do a proper examination of the thoracic region with them wearing a sports bra, then that's just fine. You can then tell them to leave that on. In my office, we do a series of computerized nerve tests using surface thermography and some other things, and those sensors have to make direct contact with the skin, and that's exactly what I explained to the patient. And then finish with, you can leave your underwear and socks on so that way your feet don't get cold. I like to add that little bit of soft humor back in as I've been telling them what they have to take off. And then there should be some sort of hooks in the exam room, and you can point to them or put your fingers on them and say, as you're changing, you can go ahead and hang your things right on the hooks over here. Please put this gown on with the opening in the back so we can see the back. That way I can examine your back. And by saying the word back 3 times like that, they actually do get it. Okay, it's open in the back. Sometimes they still ask, so you want it open in the back, right? Yes, have it open in the back so we can see the back. And then I'll say, crack the door as soon as you're ready. And then one of my staff members will come in to start getting some of the initial information. Crack the door when you're ready, see you in a few minutes, and then walk out, make sure the door does shut completely. Now, while they're changing clothes, 2 things are going to happen. Number 1, you have an opportunity to go and see 1 or 2 patients to keep the office flow moving. Terrific. The other thing is, if you utilize chiropractic assistants in your office, ideally one of those chiropractic assistants will go in to take the basic information in the examination, the vitals, height, weight, blood pressure, temperature, because as a primary healthcare provider, you are still required in most jurisdictions to get those vitals in the chart. So as the CA is getting those vitals, and you're taking or making the time to adjust 1 or 2 patients without keeping them waiting or the new patient waiting, that's terrific. If there's an additional 2 minutes, if you can then take the time right then and there to put that initial history into the computer, it's in, done, and ready for when your examination is done. So that way the chart noting is finished for that first part of the visit. If it all works the way that it should, you've adjusted 1 or 2 patients, you've put the history in, and then you swing past the front desk and or the office manager and let them know you're going back to do that new patient examination. It's important that the front desk and office manager know where you are so that way they know everything that's happening in the office so they can handle other patient situations while you're in the back. Somebody comes in, hey, I'm in a rush today, no problem, let's do your electric stim, your physical therapy first, because doc will be just a couple minutes. And then by the time you're finished with that, he'll get you adjusted and you can get on with your day. Because while it's the new patient's day 1, it's somebody else's day 17, and people are moving through the office, and this whole thing of flow just needs to work like a symphony with all the different parts. But let's zero back in on the day 1 procedures. So once the vitals have been gotten by an assistant, by the chiropractic assistant, I'll then swing back, knock on the door. Even if the door is open, I'll say, knock, knock, can I come in? And they always say yes. And I'll say, okay, so now let's go ahead and see what's really going on. I love that line. Okay, so now let's see what's really going on. Because now you're setting the stage for, we've taken the history, we've gotten the vital stuff out of the way. Now let's see why your body's doing what it's doing. And with that, we'll now go through the 9 steps of an efficient examination for a patient. I like to have the patient seated on the side of the table, sitting up nice and straight, knees bent, preferably feet not touching the floor, but if they are, that's okay, and I'll come back to that. And so now I've just said, okay, let's see what's really going on. Go ahead and sit up nice and straight, and now go ahead and tilt your chin down all the way to your chest. Okay, good. Look all the way up. Good. Look over your shoulder to the left. Look over your shoulder to the right. Now bring your ear down to your left shoulder. No, don't bring the shoulder up to the ear. That's cheating. Bring the ear down to the other shoulder. Good. And depending on the case and the patient, you can ask at each one of those stages, after flexion, extension, rotation, lateral bending, did that cause any pain? Or did that make it better, worse, or same? If it's not a cervical complaint, it's a lower back condition, I still want you to go through and do a cervical exam. The reason is we're chiropractors. We look at the entire body. We're not just focusing on the one body part. Once you finish that, then do reflexes. Biceps, brachioradialis, triceps, left and right knee, left and right ankles. And the next part of the exam is the thing that the most doctors that I consult with skip completely. It's amazing how many doctors skip this next part, and it seems to be the doctors who have been practiced the longest are the ones who are more likely to skip it. And it's probably the most important thing that you're going to do in the entire examination and in the course of doing the exam to cement your relationship with the patient. You must palpate the cervical spine. Yes, you actually have to put your fingers on them, palpate it, because you can feel those subluxations. And if there's a problem in the neck, you're going to tell them that that's where it hurts. You're not going to ask. I'll bet that's sensitive right there. Yeah, how'd you know that? Feel that right there? I'll bet that's what's causing your headaches. You're telling them, I know, and you're telling them, I know, and now I know that you know that I know. Once you've palpated, then go through and do maximum cervical compression test. And ask, does that make it better, worse, or same on left and right? Do cervical distraction, better, worse, or same? Shoulder depressor, left and right. Does that make it better, worse, or same? Easy. You've just done a reasonable and thorough cervical examination. Now you're going to squat down in front of them. Have them do a seated bec de roux. Straighten their leg out. Does that cause any pain? Then have them dorsiflex the foot also and put some pressure on there. Does that cause any pain? When they say, well, it's a little bit tight in the calf, I'll say, you don't get credit for that one. That's not what we're looking for here. And then do a seated Faber's test. Put a little bit of pressure down on the knee once that leg is crossed. And once you've done those tests on one leg, do all those same tests on the other leg. If you're a male doctor working with a female patient that is wearing a gown, you want to be cognizant of their modesty. Don't be in a position where they can even begin to think that you're trying to look up that hospital gown that they're wearing. And if you happen to be a female doctor with a male patient, I completely understand that it can be uncomfortable and feel unprofessional for you to be down on your knees next to the patient doing these things. Well, if you're next to the patient, I think that's just fine. Obviously, you would not want to be directly in front of the patient, again, because you always want to be maintaining absolute optimum professionalism while being thorough and efficient during the examination procedures. Once you have finished with that, then you can stand up. If you're going to do a Wartenberg pinwheel, that's just fine. I like to show the person what it's going to feel like and tell them this is the worst thing that I'm ever going to do. It might feel a little bit prickly, and no, it's not a pizza cutter or a pattern tracer. Once you have finished doing the dermatomes on both arms and then both legs if necessary, there's a clinical decision to make. If indeed the seated lumbar tests, the Bechders and Bonets or Fabers were positive, then I want you to lay the person down and redo them to get those exact measurements. At what point is the straight leg raise test positive? And the same would be true with Fabers tests. But if you don't feel you need to do those things, that's just fine. You can go through and do the muscle tests, working your way from the upper extremities, left and right, to the lower extremities, left and right. Once you've done that, have the patient stand up, palpate their thoracic and lumbar spinal muscles, palpate the PSISs, the PIISs, and I think you should palpate down across by the greater trochanter to see if indeed there's bursitis there or not. Very often when someone has hip pain, it turns out it's a bursitis, then you know how you're going to treat that as well. Then, since they're already standing up, go through lumbar rotation, lateral bending, extension, and Kemp's maneuver. Then I want you to stand up next to them, hold their gown shut, and ask them to bend over and touch their toes. We save flexion till last because for most people that's an acute lower back, that's the one that's going to light them up like a Christmas tree, and I don't want to exacerbate it before we need to do other tests. At this point, you can determine whether or not it's necessary for you to also do heel walking and toe walking, depending on the complaint you're looking for and if you're concerned about an L5-S1 nerve root impingement. But as you're going through and doing all of these things in the examination, I want you to be saying things like, I see, or that's what I thought. As you're going through the exam process, again, I want them to know that you're finding the things you thought you were going to find because that assures them they're in the right place. If you take x-rays in your office, and if based on the consultation and examination, that seems like the next thing to do, then I want you to say something like, okay, so I found exactly what I thought. Let's take those 2 x-rays so I can get a measurement of exactly what's shifted and by how much. At this point, you're repeating what you said in the consultation. You said, if I find what I think I'm going to find, we may end up taking 2 x-rays, or 4 or 5, or whatever the number was. And now you've reiterated, yes, I found exactly what I thought I was going to find. Again, you're cementing in their mind, this guy knows what he's talking about. And at this point, the patient may ask, so what is it? And if that's the case, this is not the time to go in depth, explaining in detail what it is and what's going on. But you can give them a brief explanation, something like, so your pelvis has shifted, so now your lower back has to work harder over time, and that's why it hurts. Or, the bones in your neck are misaligned, and that appears to be what's causing your headaches or upper back pain or arm pain, or again, whatever the chief complaints were. But I'll explain everything in detail once I've reviewed all the tests together, and that's always enough for them. And then you can finish up by saying, so I'm going to let you go ahead and get dressed. Let's set up an appointment for either tomorrow or the next day, but I want you to state what the next day is. Let's go ahead and set up an appointment for tomorrow or Wednesday. Or let's set up an appointment for either tomorrow or Friday. Give them 2 choices, not set up an appointment for whenever it's convenient, because convenient might be 3 weeks from now, and you know what? This is important. So let's get them back into the office so we can explain what's wrong and start helping them get healthy again. And then I want you to add some sort of home instruction for them to do. I don't care exactly what it is, but it's something that's going to help them get some relief and help on the road to recovery. My favorite is the use of ice. I want you to put ice on your neck for 10 minutes, off for 20. So 10 minutes on, 20 minutes off. You can do that continuously through the evening till you go to sleep. Do not go to sleep with ice on it all night long, because that'll create a whole nother problem that we'll have to unravel tomorrow. I like 10 minutes on for the cervical, 20 minutes on for the thoracic, and 30 minutes on if it's the lumbar or pelvis region, and then off times as appropriate. And then tell them, so you can go ahead and get dressed now. When you're ready, stop at the front desk and they'll get you set up for that appointment for either tomorrow or Wednesday. It was great meeting you, Sue, and I'll look forward to helping you get rid of this problem and really be healthy again. And then as you walk out and shut the door, go straight to the front desk and say in a loud, clear voice to the front desk person, "Today we did a full consultation and I took 2 x-rays of her lower back. Please set up a report of findings for tomorrow or Wednesday and be sure I have enough time to answer all of her questions." And the reason I want you to say this loud enough is so that everybody in the immediate area can hear you. I want all of your patients to know that you take time to answer questions for everybody and that you did a full consultation and a full examination. And then once you have done that, make sure you walk away from the front desk. You do not want to be standing at that front desk as the front desk CA is negotiating the appointment time with the patient, because you as the doctor usurp the front desk CA's authority when you're there. When you're not there, she's the big honcho and is running the show. And once that appointment has been set up, the front desk CA should give them some sort of appointment card that has the day and time on it. It should also have a contact phone number and let them know, so we're here till 7 o'clock tonight. If you have any problems or questions, be sure to let us know that. And that, my friends, is how we do a fantastic day one. The purpose of day one is to get all the information. I want the patient to know that they're in the right place. And as that new patient is walking out of your office, I want them to think that they really like this doctor. They really like your team. In fact, they like everything about your office. Because if we get that right, day 2, the report of findings, gets really, really simple. It's so simple because you know what? You like me and I like you. So here, follow me. This is how we're going to solve this problem together. But that's part of that great report of findings. Because when we get day 1 and day 2 right, patients accept the care recommendations you're making for them so they truly have a chance to be optimally healthy again. And then you have an opportunity to be their chiropractor for the rest of their lives. So now it's the end of the practice day. And maybe you've had 1, 2, 3 new patients today or this shift. I think at the very end of the shift, at the very, very latest, at the end of the day, you should take the new patient chart, the history, the examination findings, computerized nerve test, x-rays if you took them, or reports from an outside imaging center if your staff has been able to get them, and sit down with all of that information and put together in your mind exactly what's going on with this person and what you're going to do for them. You can list the diagnoses onto the chart. You can make sure all of the information is set up in the computer the way that it needs to be. If you do any type of markings on your x-rays, get those done, get those x-rays read. I think you should even have done a short x-ray report to have in the chart and is always accessible as needed. And by the way, you don't necessarily have to wait to the end of the shift or the end of the day. If there's a momentary lull in the action, a few minutes in between patients that you want to take and pull all this information together, I think that's terrific also. But when you're reading films and going over tests, make sure that you're very clear of mind so you can take all things into consideration so nothing gets overlooked. By doing all of this on the same day, you have a very clear recollection of the patient and what was going on. It's easy to put this all together. As your practice gets busier and busier, and maybe a day or two goes by, suddenly you don't really remember the person as well. By doing it on the same day, it sometimes comes up, oh, I should have done that test also. I didn't think of that. That's fine. You can make a note of it and do that the next time the person comes in the office. Your staff will appreciate, your billing people will appreciate you getting those diagnoses in immediately because the billing can go out if it's any type of insurance case. Now, when you go home at night, the patients have been taken care of. the paperwork is taken care of, the staff is happy that all that paperwork has been taken care of properly, and you can leave the office locking up, getting a good night's sleep, because you've taken care of all the things that need to be done so you're ready to start the next practice day when this person comes back for their great report of findings. All right, and that's our show for today. If you have a question about today's show or your own practice, feel free to reach out at fortheloveofchiropractic.com. Before making changes to your practice, be sure to seek legal advice regarding those changes and regulations in your state. For the Love of Chiropractic is an RGF production, all rights reserved. And thanks for listening. Original music provided by Hunter Rich Music.